Your Excellency, Honorable Minister, you are welcome to the V.V.F Center, Birnin Kebbi. This is a hospital that caters for women who have been having some problems during childbirth. They get a complication of urination. So this is a place whereby we take care of such patients. We repair them and then they get back to normal life. In fact, His Excellency has just given us an order that we should go to virtually all the local governments, not await a woman to come and complain, but we should go to virtually all the local governments, screen those deserving patients for fistula, for hydrocele, and for uterine new development, that we go outside to screen them. Thank you.
Yes,
and it's being handled by Nigerian women, and it is being done, giving support even to other states. We are grateful on behalf of the National Council of Society, on behalf of the First Lady of the Federal Republic of Nigeria, Your Excellency, I say thank you so much.
Just come to your name and your address.
Okay. My name is Haja Hafsa Tijani. I'm a member of Women in Nigeria. My question to who is the medical officer in charge? Oh, it's not here. Okay. My question here is, knowing that V.V.F is a very complicated ailment, bedeviling women who were affected with prolonged labor and all that, what is the percentage of success in operating these women? You see, no, some will be operated 2-3 times before they get well. So what is the success of the operation? Some you operate once, twice, or thrice, and when they get well, you do have skills, or you send them to skills acquisition center to get something doing because of the stigma and the rejection from the members of the family.
Excuse me, this center is being collaboration with the Ministry for Women Affairs. The Ministry of Health caters for the nurses, doctors, and what have you. When a patient is brought here and he gets well, then he is asked to go back to the Women Affairs for rehabilitation and to learn some trades. The success story of the center, in fact, it's 90%. I assure you that it's 90%. We have competent hands, we have competent gynecologists who come here to operate. Thank you.
Well, any question from the press? Must be very brief if you have. Thank you, because we have. But Your Excellency, let me commend the state government for maintaining this center. People used to think that V.V.F is only for early marriages. That was the initial ignorance that we pervaded in this country. Then we went to Ebonyi State and we went to see the center for V.V.F, which was also started by the First Lady of Ebonyi, but not taken over by the federal government. We discovered women from all the southern states, all the south-south states. You know, so people now come to appreciate that V.V.F is not only for early marriages, prolonged labor, particularly in communities where there is no modern health care. This has affected women, and that is why this problem exists in all parts of the country. Here it is more prevalent in areas of early marriages, but it's not restricted to early marriages. What the first appeal I will make to Nigerians: why should you stigmatize a woman who only had a problem because she wanted to give birth, or she's in the process of giving birth to another human being? Why do you stigmatize against them? Because they have not done anything wrong. They're only fulfilling the most important duty that has produced all of us who are living. All of us, people gave birth to us. It could have happened to any of our mothers, any of our daughters. So the idea of stigmatizing against them is something we must campaign against. What they need is sympathy, protection, and help. What these women need, sympathy, protection, and help. And that is why the federal and state governments, Women Affairs Ministry, the First Lady of the Federal Republic of Nigeria, all of us are working together to make sure that all women in Nigeria that have this problem will correct it. Thank you, Your Excellency, for this support here. And particularly, come forward, is your day. Our mommy, the nursing officer in charge, she sounds very competent. She even knows the number of her patients, those who have been operated, and everything. That is how it should be. So we want you to continue to work hard with all the workers here. And the state government is already behind you. The governor is here. And the federal government, all of us. Our prayer is that the local government chairman, just like the governor's program, bringing out the mentally ill people, mobilizing them. So all those women who have not even declared, we need to look for them and bring them out. So the women societies, particularly the NCWS, the various women NGOs, they should partner with local governments to fish out all those women that are affected so that they can have their problems corrected. And thank you very much. We hope this is the kind of Medicare that addresses the social need of people. So we're really very happy.
And a market just opposed to the estate. We took the whole two estates together and designed routes, designed the drainages, and we did them at once so that it will look the same, it will serve the same purpose. The system will take the water and drop it around that factory, rice factory that we have gone to. And that is what we have been doing for Kebbi town, completely. Any area we take completely. We don't take one road, as you see in other states. Thank you very much. From here, we'll move to Central Bank to Saka, Saka to